As we begin a new year, I want to speak to you about the ongoing battle with COVID-19 and the challenges posed by the Omicron variant. Throughout this pandemic, I made a promise to you to speak plainly about the virus and how Ontario is responding, to share with you what I know, what our experts have told us, and to never shy away from being upfront with the people of Ontario. As you know, like in other provinces and countries around the world, Omicron case counts are rising exponentially across the province. We face a tsunami of new cases in the days and weeks ahead. And as we do, virtually everyone in this province will know someone who has been exposed to this virus. Now, we're bracing for impact. Based on our real-world experience here in Ontario, the evidence tells us that about 1% of people who get Omicron will end up in the hospital. That may not seem a lot, and under past waves, it might have been something we could withstand, but Omicron isn't like the other variants. It's much, much more transmissible. So the math isn't on our side. Based on the current trends, our public health experts tell us we could see hundreds of thousands of cases every single day. 1% of hundreds of thousands is too many new patients for our hospitals to handle. Over the past few days, we've started to see an alarming number of new hospital admissions, now with triple-digit admissions into hospitals every single day. This is a problem that will only get worse as we confront the looming wave of Omicron. The reality is that people are coming into hospital and leaving soon after, sometimes only staying for a couple days. This is a very different problem than we faced in the past, when COVID hospitals stay were weeks long in intensive care units. But even so, with Omicron surging across Ontario at a current rate, Ontario Health modeling tells us we could be thousands of beds short in the coming weeks. We can't let that happen. This data is a clear call to further action. We must do everything in our powers to protect our hospitals and to ensure our frontline workers aren't overwhelmed. We've been adding new beds across the province for many months and will continue to do so. The investments we've made in our hospitals are larger than any previous government in the history of Ontario. But with a variant as infectious as Omicron, with spreads like nothing we've seen before, added capacity alone isn't enough. We need to implement measures that further reduce contacts and mobility. Effective Wednesday, January 5th at 12:01 a.m., Ontario will return to a modified Step 2 of the roadmap to reopen. The plan will be released before we confronted Omicron, laid out two clear reasons why we would implement province-wide measures. First, the introduction of a new variant. Second, if our healthcare system was threatened. Today, we face both of these. Our plan demands that we implement additional public health measures. Minister Elliott will share details with you shortly on what exactly this entails. But it will mean the closure of more indoor spaces where we know the risk of transmission is higher, especially with Omicron. But let me be clear, these will be targeted and they will be time limited. The immediate goal of these measures will be to blunt the latest wave so we can ease the pressure on our hospitals and allow more time to deliver these all-important booster shots, which continue at a tremendous pace. Because vaccines remain the key to our long-term success against this virus, and the call to arms we issued last month has been answered loud and clear. We have delivered over 24 million shots to Ontarians, including 3.7 million booster shots. And over 1,300 regulated healthcare professionals, both active and retired, have stepped up to support the vaccine effort. This includes firefighters, first responders, and health professionals. This display of selflessness and Ontario spirit has exceeded our expectations, and we are so grateful to each and every one of them, but we need to give our booster effort time it needs to succeed. And that means doing whatever possible to slow the spread of Omicron. And I say slow the spread because it can't be stopped.